welcome to the Alliance for Hope International Affiliated Centers webinar series. My name is Rayanne, and I am the Assistant Director of the Family Justice Center programs. I'm excited to host this series that will showcase each of our affiliated centers by giving them an opportunity to share information about their sites and the work they are doing in the community. For more information about becoming an affiliated center or creating a center in your community, please visit our website at allianceforhope.com. I now have the great pleasure of introducing Susan Kim, who will introduce herself and take you on a tour of the Contra Costa Family Justice Center. Susan?
Good morning. Thank you for having me. Contra Costa Family Justice Center opened first in 2011 in Richmond, California, and we opened our second Family Justice Center in Concord, California in 2015. And Contra Costa County is one of the larger counties in the Bay Area in California, and it is a very diverse and geographically large county. And because of our unique population and geography, we decided to have two centers, one in the western end of the county and the second one in Central County. And we are right now planning to open another county in East County. And our Family Justice Center is unique in that we are really a public-private partnership, and I could go and talk about that a little bit. But before that, I just want to share with you our presentation slide that we use very often to let people know about the Family Justice Center model, which is to put the victim in the center and really figure out what the victim needs. Without the Family Justice Center in our community, before 2011, our victims of interpersonal violence had to navigate through so many different systems and had to figure out their locations, their office hours, eligibility criteria, and just figuring out even one system to get a restraining order could be very difficult. And because our county is so large and public transportation system is very inadequate, some victims actually had to travel 4 hours on the bus, several buses, to go to the courthouse to get a restraining order. Likewise, getting assistance from different law enforcement agencies or the child support assistance, all of those things really were difficult and people had to go through many different systems. So we put the Family Justice Center together and put the victim in the center and surround them with different types of services. And the first thing obviously we try to do is crisis support. But I think what's unique about our Family Justice Center is that we really then start working on long-term safety after dealing with crisis. So the goal for crisis support obviously is safety, while we bring long-term safety programs to help her get to independence and self-sufficiency. And we define our long-term safety in 4 domains. We work on her health, including mental health services, bring education and training programs to the center so that our clients can really start working on their education. And then wealth, there are a lot of programming that we try to do to help her understand her financial situations and figure out her wealth management. And then finally, community, because we believe that to really address interpersonal violence, we need to help build engaged and informed and supportive community around our clients. So that is our service model, and that's what we try to bring together to provide services to our victims and to really strengthen our community. So in just a few years, we have grown to 30 on-site partners. So what you see here is some of our partners. And as I mentioned, we are really public and private partnership in that we have 6 different law enforcement agencies at our center, including the Concord Police Department and Richmond Police Department. And we also have several county public partners. For instance, we have county social service agency providing assistance with public benefits applications. We also have APS, Adult Protective Services staff on site to assist with elder abuse cases. We also have ombudsman who helps people with who are living in assisted living facilities and who also see abuse in those facilities. And we have a lot of nonprofit partners, including Domestic Violence Advocacy Agency. We also have Housing Service Agency, and we work with also National Alliance on Mental Illness. So the list goes on and on and on. And we are growing still. We are trying to currently expand our mental health counseling services because that's still much of the unmet need. But in the meantime, in 2016, we started our first legal incubator program called Lawyers for Family Justice. And just in 1 year, in 2016, we were able to provide free legal assistance to almost 400 domestic violence and interpersonal violence victims. And the reason why we put this program together is because our local legal aid program was very limited in terms of how much staffing they could provide. They were coming into our centers about 3 hours a week. And 3 hours a week really was not enough, given that really the number one requested service was legal services in terms of restraining orders, custody, and family law. And because I'm an attorney and family law attorney by training, and I used to work at Legal Aid, I was able to set up this legal incubator program and provide assistance and support to our lawyers. So this program right now is in our second year, and we have 9 attorneys. So every afternoon at both family justice centers, we have an attorney available to talk to clients about their legal issues. So I think that's been a really great program, and I would be happy to talk to other people about how to start a legal incubator program in their centers. And here is just some information about the different types of interpersonal violence we deal with. Obviously, the vast majority of our cases are domestic violence cases, but we definitely have seen an increase of sexual assault cases, and we started seeing some human trafficking cases as well. And here's some information about our clients. This data is from 2016. What was really interesting to me is that most of our clients have children in their homes. And I think that really should pause us there and really challenge us to really think about what we are doing for our clients and their children, and think about providing whole family support, and think about really looking at children's programming. We have limited children's programming, and we have found it challenging to really develop that area because we are fairly new and we are still building our crisis support, and then only recently we started building long-term safety programming. So I think the next step for us is really looking at the children, because so many of our clients have children living in their homes. Another thing to note is how many people are low income who are coming to our centers. So that really brings a lot of different challenges in terms of access to education, access to services, and really looking at long-term plans and safety. Because if you're low income, there are just limited resources, and it's sometimes easier to just stay in abusive relationships or to go back to abusive relationships for those economic reasons. For example, 45% of our clients are unemployed. Some of them is really situational unemployment because they have young children. Others have never really worked in the USA. A lot of people are on public benefits, and 20% had no health insurance. So there was a big finding for us in 2015 when we started really looking at our numbers. So in 2016, we brought in a partner called Rhoda Care, and they provide free medical services to everyone who's coming to our center. And that has been a really great partnership because Rhoda Care uses our space to provide free medical services, and then they give priorities to all of our clients who are experiencing health issues. And they have really provided valuable free medical services to our clients. Obviously health issues really cause all kinds of stress and could lead to other bigger issues. So having Rhoda Care as an on-site partner has been a really great help. In terms of race, I think a lot of our clients are Latinos because, in Contra Costa County, we have a growing immigrant Latino population. That's one reason. And another important thing is because all of our staff, except for actually one, are bilingual Spanish speaking. I speak a little bit of Spanish myself, so I try to jump in whenever I can. So I think we are very well known. We have become well known in the Latino immigrant community as a place that is safe and the place where they could come and get help. So we are definitely seeing a lot of Latina clients, and we are happy to be assisting them. In terms of our top client needs, certainly it was advocacy in terms of domestic violence or sexual assault, comprehensive case management, advocacy services. But the next two needs are legal needs, family law and restraining order. So that is why we started Lawyers for Family Justice, and that's been a very successful program. In addition to providing client services for crisis support and long-term safety, we also, as a Family Justice Center, provide backbone support to our partners. As I mentioned, we have 30 on-site partners. Actually, as of yesterday, we have 31. So what I mean by backbone support is that, there's this collective impact initiative theories that have come out of the Stanford Social Impact Institute articles that came out a few years ago. And we really looked at that, and we thought about how we could position ourselves as a collective impact initiative, really to move the dial and to change our community in terms of reducing and preventing future violence. And to do that, backbone support organization, it really is essential and critical. And the Family Justice Center in our community really is well positioned to provide that backbone support. So one of the most important backbone support functions is really to support capacity building of our partners, because we do our work through our partners in partnership with our partners. So some of the activities that we do for capacity building includes Family Justice Institute, so which is like our multidisciplinary school. We have a lot of workshops that are free to our partners and community members. And the Institute covers various topics like elder abuse, restraining order, interpersonal violence 101, human trafficking 101, child abuse, mandated reporting, many different topics. And our partners present on these topics. And we, as the Family Justice Center, provide the platform and evaluation and marketing for these Institute workshops. As I said, they're all free and they are widely popular. And whenever we have any workshop up on our website, they get filled like in a day or two. The most recent workshop that was really popular was about cyber stalking, presented by one of our deputy district attorneys. And he really enjoyed this workshop because usually our deputy DA without the Institute would just go and train different law enforcement officers or train their other DAs. But in this case, because this is multidisciplinary, we were able to bring a lot of people who work in the school systems. And they really appreciated this training, and they really saw the value of the partnership with law enforcement. So they don't usually think about in the education setting, how to really work with district attorney's office. They find it sometimes a little intimidating, but in the Institute setting, everyone felt really well supported and learned together. We also host and coordinate monthly multidisciplinary team review meetings in the area of domestic violence and also human trafficking. So MDT models have been used in many different areas, especially in the elder abuse and child abuse settings. And in our community, the Family Justice Center has led and created the domestic violence MDTs and human trafficking MDTs. And these MDT meetings have been really useful to brainstorm with multidisciplinary professionals to come up with solutions for our clients. But also it's been really great training opportunities and networking opportunities for all the professionals involved. We also hold annual law enforcement training on various topics. And this year, our training topic included how to work with LGBTQ victims, and that really built a partnership between our law enforcement partners and LGBTQ communities, and that was really amazing. And finally, I want to introduce our new elder abuse prevention project, recognizing that the fastest growing population in our community is the elderly population for people over 65, and we provided a coordination roles to our elder abuse prevention coalition and for the project. So this is how you could reach us. If you have any questions, you could call us. You could check out our website. Our website has a lot of information. We try to keep our website updated. We get a lot of visits to our website. We have found, I think we get like 300 visits per day. I think our graphic is a little dated. We're going to try to change the graphic a little bit, but the content is always updated, and it has a lot of information for anyone who wants to learn more about our work. So that's kind of the Family Justice Center in a nutshell in Contra Costa County, California.
Thank you so much, Susan. It's been really fun to see how much your center has grown over time. So I'm really excited for you all. Tell me, what's the one thing that you're most proud of to this point?
Yeah, that's a good question. One thing, I would say that we have really built this Family Justice Center as a public-private partnership among the county, cities, law enforcement, and nonprofit partners, and that the working relationships in our centers between community partners and law enforcement agencies have improved tremendously. There's really a lot more trust and just a lot more coordination among these partners. So I would say that partnership and the quality of relationship is something that I'm really proud of.
And I'm sure the survivors can see that too.
Yeah, I think that the impact that they see is pretty immediate, because, for instance, we have a client coming in, try to reach out to the police, try to make a police report, and they couldn't for whatever reason, and our navigators can very quickly contact the law enforcement agency partners and resolve their issues. And yeah, I think that the results have been pretty amazing.
Wonderful, thank you. Can you tell me why you decided to affiliate with the Alliance, and how that has helped your center?
Oh my goodness, yes. I think that Contra Costa County leaders of the interpersonal violence sector have been involved or been interested in the Family Justice Center Alliance for years. I think we actually applied to be one of the president's initiatives and didn't make it. But later on, I think we got the support through the Alliance with the Blue Shield grant. So, our involvement has been very, long-standing, even before we opened our first pilot center in 2011. So, just to talk about kind of that historical involvement and relationship building with the Alliance, that's been very important to us. But more practically speaking, I go to the conferences or executive meetings, and I learned so much. For instance, our Lawyers for Family Justice started because I went to one of the meetings in San Diego, and they talked about their legal incubator program, and I said, oh, I could do this. I'm a lawyer. So we started that. Our RotaCare partnership really is because we learned about the health partnership project that was initiated by the Alliance, and we were like, oh, that sounds really good. We should try that. So, just that opportunity to learn from one another and, really think together and learn from the Alliance. Yeah, I think really made it possible for us to have our center.
Great. And finally, what is one piece of advice that you would want to share with open centers or developing centers?
Well, I want to say one thing that I think is very unique, which is our community building initiative. We came to realize that we cannot really address interpersonal violence without an informed and engaged and supportive community. And because so many of our victims don't first call law enforcement, right? And they don't even come to us, service providers. They go to their informal support systems, their neighbors, their sisters, their moms, their co-workers. And I think it's really by engaging those informal support systems and strengthening them, we could really start making an impact and change the dialogue and conversation. And I want us, the Family Justice Centers, to really think about that as a role. I tell people, my center is not a domestic violence shelter in a confidential location. We are actually out on the street. We are open. This is a public space. And we like to be that public and open, and we like to be inclusive, and we like to talk to community members and be part of that community. And I think that's really important to us. And related to that, to me, is the really concept of equity and power sharing, because so many of our clients feel powerless, and some of our smaller nonprofit organizations or culturally specific organizations feel powerless when they are dealing with public systems, especially law enforcement. We have smaller nonprofit organizations such as Latina Center or NARICA that is working with South Asian community, or Rainbow Community Center, LGBTQ community organization. They, traditionally had a very difficult or sometimes antagonistic relationship with law enforcement partners, right? Mm-hmm. But these cultural specific organizations have such important roles in these communities, marginalized communities. So I think for us to really address interpersonal violence and find ways to prevent it, we need to engage all kinds of communities, including marginalized communities, and help build those relationships, help build those bridges with law enforcement partners and other public partners. So just really thinking about that issue around equity and power share, that's, I think, very important to us. So when we set this table, that is the Family Justice Center, we have one seat for each partner. So we have a $200,000 nonprofit organization, culturally specific organization get one seat. And we have, multi-million-dollar DA's office gets one seat. Everyone gets one seat at the table, and everyone collaborates and everyone works together. And I think that's where our, beauty of our work can come in, and the real change can come in when we actually change power dynamics. Because remember, interpersonal violence is really about power and control, right? So we need to really model and practice, the whole concept of equity and power share. And all of us can do that. So that's kind of what I would ask our partners to think about, what it means to really be in the community, be part of the community, be in relationship with the community we serve, and what it really means to share power. So I now can get off my soapbox.
Well, thank you so much for doing this recording with us, and thank you for those of you who are watching this webinar. And we will have more of our affiliated centers webinars as part of the series in the future. So take care. Thank you.